Are you searching for how can I stop my baby's teething pain fast? I hear this question from so many new mothers. It is so hard to watch your sweet baby struggle with sore gums. You feel their discomfort, and you just want to make it all go away. The good news is that you can. I have seen thousands of babies and their tired parents find quick relief with a few simple tricks. For instance, I once helped a mom whose baby had been crying for 2 days straight from teething pain. We used a simple gum massage, and within a minute, the baby's crying softened into a gentle coo. These methods work, and they can bring peace back to your home, often in just a few minutes. First, let's make sure it is indeed teething that is causing the fussiness. The signs of teething are usually quite clear. Knowing what to look for can give you confidence. You will likely notice your baby drooling much more than usual, sometimes soaking the front of their little shirts. They will also want to chew on everything they can get their hands on: their fists, your fingers, toys, the side of the crib. This chewing instinct is their natural way of trying to relieve the pressure on their gums. Many babies become extra fussy, irritable, or have trouble sleeping and waking more during the night. You are not imagining it. This change in your baby's mood is a real part of teething. Once you recognize the signs, you can take immediate action with the simplest tool you have: your own touch. Before you do anything, wash your hands very well with soap and water. A clean finger is a safe and effective teething tool. Gently and with very little pressure, rub your baby's gums in a small circular motion. Focus on the areas that look red or swollen. This gentle counter-pressure can provide instant relief from the ache. Many babies find this incredibly soothing. Watch your baby's cues. If they seem to enjoy it, continue for a minute or two. If they pull away or cry more, stop and try another method. Another common sign is slightly reddened or swollen gums near an emerging tooth. Sometimes you might see a little white nub under the surface. A very low-grade fever, just slightly above normal, can also accompany teething. But a high fever is not typical of teething. If your baby has a rectal temperature of 100.4 degree, 38 degree, or higher, call your pediatrician. This could be a sign of an infection or another illness that needs attention. Always trust your instincts about your baby's health. One of the most effective and safest ways to ease teething pain is by using the power of cold. Cold temperatures help to gently numb the sore area and reduce inflammation in the gums. A fantastic first choice is a solid silicone teething ring. Pop it into the refrigerator for about 15 to 20 minutes before giving it to your baby. The coolness will feel so good on their hot, tender gums as they chew. It is very important that you only chill the teether in the fridge, not the freezer. A frozen teether can become rock hard and could actually bruise or harm your baby's delicate gums. Always check on your baby while they are using a teething ring. If you do not have a teething ring handy, don't worry. You can create a soothing teether with an item you definitely have: a clean baby washcloth. Simply wet a portion of the cloth with water, wring out the excess, and place it in the refrigerator for a short while. Once it is nicely chilled, you can give it to your baby to gnaw on. The soft, nubby texture of the cloth combined with the soothing cold can work wonders. Some parents find it helpful to roll up the cloth tightly and chill it, making it easier for tiny hands to hold. This is a simple, safe, and cost-effective trick for battling that tough teething pain, and you can prepare a few at a time. When you are choosing teether toys for your baby, safety is the #1 priority. Look for teethers made from soft, food-grade silicone labeled BPA-free. This ensures no harmful chemicals will be ingested. Avoid teethers with liquid inside; they could leak or break open. Steer clear of toys with small, detachable parts, choking hazard risk. A good teether is one solid piece. Inspect teethers daily. Watch for wear and tear. Cracks, holes, discard damaged items. Offer certain chilled foods only after starting solids. Use a mesh feeder. Chilled, not frozen, banana, large chilled strawberry, chilled cucumber in the mesh bag. Baby enjoys cool, soothing relief and taste without choking on large pieces. Always supervise closely. Turns a fussy moment into a happier one. More than just toys. Sometimes, the best comfort for a teething baby comes directly from you, mom. The act of breastfeeding can be incredibly soothing. Skin-to-skin contact. The familiar comfort of nursing. The rhythmic sucking motion. You might notice your baby wants to nurse more frequently. This is their way of seeking comfort and security. For other babies, the suction of nursing can sometimes increase the pressure on their sore gums. They may pull away. Be patient and follow your baby's lead. A little extra cuddle time, even without nursing, can work wonders. When simple comfort measures are not quite enough, it may be time to consider pain medicine. It is crucial to use these medicines safely and only when necessary. For babies over 6 months old, infant ibuprofen, like Motrin or Advil, can be very effective. It helps reduce inflammation in the gums. For younger babies, or if you prefer another option, infant acetaminophen, like Tylenol, is also a safe choice. Always follow the dosing instructions on the package very carefully, based on your baby's current weight, not their age. If you are ever unsure about the correct dose, a quick call to your pediatrician's office will provide the clarity you need. It is important to know which products to avoid. You may see teething gels or numbing creams like those with benzocaine on pharmacy shelves, but these are not recommended for infants. The U.S. Food and Drug Administration has warned that benzocaine can cause a rare but serious condition called methemoglobinemia. Methemoglobinemia reduces oxygen in the bloodstream. Likewise, you should steer clear of amber teething necklaces. These pose a significant strangulation and choking risk, and there is no scientific evidence they actually work to relieve teething pain. Sticking to proven, safe methods is always the best path for your baby's well-being. Never underestimate the power of a gentle distraction. A change of scenery can sometimes be all it takes to shift your baby's focus away from their sore gums. Try singing a soft, calming song. Put on some gentle music, or walk around the house while holding your baby upright. The motion and the new things to look at can be a welcome diversion. A warm bath can also be very relaxing for a fussy baby. Often, the combination of a simple remedy, like a cold teether, followed by a loving distraction, is the perfect recipe to get through a tough teething spell. Section 4. When to call the doctor and a note of hope for tired moms. As a parent, your intuition is your superpower. While most teething symptoms are mild and can be managed at home, it is essential to know the signs that warrant a call to your pediatrician. If your baby develops a high fever, generally considered 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher, it is time to call the doctor. A high fever is not a typical symptom of teething and usually points to an underlying illness or infection that needs to be diagnosed. Similarly, if your baby is experiencing persistent diarrhea, vomiting, or develops a rash along with their fussiness, these are also red flags that something other than teething is going on. Do not hesitate to seek professional medical advice. You should also reach out to your pediatrician if your baby seems to be in severe or inconsolable pain. While fussiness is normal, constant, high-pitched crying that cannot be soothed by any of the usual comfort measures could be a sign of something more serious, like an ear infection. If your baby is refusing to eat or drink for an extended period, or seems unusually lethargic and hard to wake up, these are urgent reasons to contact your doctor right away. Your pediatrician is your partner in your baby's health, and they are there to help you navigate these confusing symptoms and rule out any other issues. To help you keep track of this challenging phase, you might find it helpful to keep a simple teething diary. In a small notebook or on your phone, jot down when your baby is the fussiest, what symptoms they are showing, what time of day the pain seems to be at its worst, and which remedies seem to provide the most relief. This can help you identify patterns. For example, you might notice that your baby is always fussier in the late afternoon and that a chilled washcloth works better than a teething toy. Sharing this log with your pediatrician during a visit can also give them a clearer picture of what your baby is experiencing. I want to end with a hopeful, calming note for you, Mom. I know how exhausting and stressful this time can be. Hearing your baby cry and feeling helpless is one of the hardest parts of being a parent. Please remember that teething is a temporary phase. It feels like it will last forever in the moment. But these tough days and sleepless nights will pass. You are doing an incredible job. By offering a gentle touch, a cold cloth, a safe toy, endless cuddles,